And for this next discussion is for us to talk about what is a subungual hemorrhage or subungual hematoma. So anytime you hear ungual, they're actually talking about the nails. Okay, so it's just all about talking about all those blood vessel complications, okay, that could lead to bleedings, and the bleeding could actually occur under the nail, which you call the subungual hemorrhage. So for subungual hemorrhage, it refers to bleeding that occurs beneath the nail plate. That's either the fingernail or toenail. It can be traumatic or associated with the systemic disease. Okay, so the most important part of this lecture is for you to know the different things that could make blood bleed under your nails. So subungual hemorrhage is just collection of blood under the nail. Okay, often presents as splinter hemorrhages, thin or red-brown lines running longitudinally under the skin. So causes could be trauma, okay, or the stubbing nail toe hitting the finger. Systemic disease could be due to infective endocarditis, could be due to what, vasculitis, as inflammation of the what, blood vessels, could be due to collagen vascular diseases. All right, so other conditions, it can be caused by psoriasis, can be caused by what, onychomycosis, where the fungals actually infecting the nails. It can cause by blood conditions like what, thrombocytopenia. So if you have low platelets, naturally you just be bleeding anyhow, so you can also still bleed under the nails. So clinical features, you have linear reddish-brown streaks under the nail, known as the splinter hemorrhages, localized dark patches if traumatic. So that's the appearance, right? Symptoms usually painless, but if it is painful, that means what, it was caused by trauma. Okay, so that's what we have. So diagnosis, you can actually see it on clinical examination. You can also do blood tests just to identify what is actually causing bleeding under the nails. Okay, so blood workup. So management, if it is trauma, depending on what is causing it. If it is underlying disease like infective endocarditis or any other systemic disease, you basically give drugs to target that disease and you solve the issue on this other side.